Good afternoon, ladies and gentlemen. Welcome back to our interview series with top public health leaders. We start with the first question. How do you define leadership? What it means for you?
I think leadership is to communicate effectively, and one of these communication abilities is persuasion, to convince people to believe in the right course of action.
To me, leadership is the power and the process of effective influence. Leadership is influencing others to see, to think, and to work together to achieve successful positive change.
And so for me, it's a combination of having a clear vision what public health is about and what we should do. And this has to be combined with good management skills. And I think that is very important for public health, the willingness and the ability to make clear and sometimes unpopular decisions.
Yeah. So it's basically securing a setting where people feel safe to do their thing in the interest of the patient, to motivate them, and to secure that they know the targets that we run after.
Well, leadership, what you can see in several books, there are several definitions of leadership. For me, how I use it in daily practice is that I say, well, leadership is formulating goals and setting priorities in the field that you work. The question that should be answered by a leader or leadership is, are we doing the right things?
This is the first word I would like to use, this responsibility. The leader is someone who is responsible. The second, I think, is important for me is a vision. I mean, you have to think out of the box. I mean, this is easy to say. The third would be the instinct. The last one, which I think is also quite important, I call this is that you should be loyal to your people, to your organization, to yourself. So when you wake up in the morning, you see your picture in the mirror, you say, okay, I am, this is me.
What is a leader? I think a leader is someone who has followers.
With followers, yes.
That's probably the best definition, especially in science. You're creating the possibilities that others can do their work, that others can work in a nice way, how to cooperate with each other. It should be a flat organization in which people feel heard, feel helped, and feel facilitated by their leader.
What is leadership in public health?
Compared with general leadership, public health leadership should focus on pursuing an optimal balance between health and social justice.
Leadership in public health is influencing the whole government and the whole society to achieve equitable and sustainable population health gain. It takes evidence at one hand and the courage to defend human rights at the other hand.
Exactly the last point that you have to make decisions where you don't have all the information you need. So the ability to make decisions under risk is something that is special for public health.
And to find the right balance there, I think that's one of the tricks that you can only learn by doing. I'm sure about that. You can't teach that from a book.
Yes.
You have to practice it. That's a thing you become better in. The more days you practice it, you increase your skills in there. I think that's very important.
And in my view, there is a distinction, because in the healthcare sector, then you have to deal that is directed to individuals with a certain health problem. And public health is more directed to the population at large, or certain groups, for instance, with a high risk in the population, or is directed to people with a socio-economic, with a low socio-economic status, for instance.
So I think it's a lot of colors of leaderships. Very much depend on the field of public health you are working. So I don't like to tell you that this is one package of skills you have to have
That
as
you
a
require,
leader.
yes.
You really need to come to, depends which discipline you're working in public health, and then see what is the most.
What do you think about public health nowadays and leadership in public health?
Yeah.
And why?
Public health leaders need to think globally but act locally. We must learn from other countries and share our experience with those in need.
Well, for public health today, I think the hand with evidence is strong. However, the hand that should hold courage is a little bit too weak. It's probably because traditionally, public health workers were more trained as a professional rather than a leader. The future training should emphasize more on a leader's capacity to deliver effective political engagement, political dialogue, and intersectoral collaboration.
And to do a right assessment is a science and an art. It has both sides. The science is more to have a proper health needs assessment, perhaps based on indicators, facts and figures. But the aspect of the art, listening to the people on the street, to getting anecdotal evidence, or looking ahead into the futures, what problems come up, that is then the art of a needs assessment that public health can bring forward.
So one of the big topics in our sector is how can we secure that healthcare is available to everyone on the moment people need it, without differentiating it to different types of patients. And at the same time to secure that this service is offered on a cost basis, that it's still achievable for people to pay for those costs.
Really very important. That's number one for me. That's on my agenda,
Yes.
is that you should be content driven. What I also see is that some people want to develop themselves as a leader,
Yes.
while they do not have, at the age of 20, 25, do not have really the competences of being a leader.
Okay.
And the question is, can you educate those people to strengthen their competencies?
Okay.
And the question is that possible or not? And I think in some cases it is possible, but on the other hand, we also do not want to have all the people that get education in the
In
field
leadership,
of public health
yes,
as a leader.
yes.
So it's also good for yourself to know, do I have the competencies of really becoming a leader? Because we also need other people in the management or in the execution of the things that should be
yes.
done, and et cetera, et cetera.
The only thing is, which is really different, for instance, compared to social sciences or biomedical sciences, is that the topic you're studying is much more connected to the society.
The interview series are supported by the European Commission Lifelong Learning Programme and are part of the Leaders for European Public Health Erasmus multilateral project. Thank you very much.
Thank you.